Okay, my Facebook page lit up yesterday talking about hernias. When I met my husband, he had a pretty nasty umbilical hernia that would pop out like a little bubble, okay? So we can have hernias all over our stomach area. There's all different types, visceral, inguinal, hiatal, okay? But the ones we're talking about is where the center line splits. And that's the most common because we have two muscles that run down, which are kind of like our six-pack muscles, and they're held together by fascia. Now, if you've ever had a baby, or blow your stomach up like you can and make it look like you're pregnant. If you're a man and you look like this, stop. In all likelihood, you have at some point torn that fascia. Okay, so this video is to teach you how to check for it. So number one, you're gonna get into this position and you're gonna take your fingers, and you gotta relax, sorry, drop your head. So relax your stomach completely, and you're gonna take your fingers, and I want you to be real stiff fingered like that, and you push down into your belly, and then you do a head lift, okay? So what you should notice about what happened with Dari, and just keep testing all the way up, okay? So go down, you have to be relaxed, stick your fingers in, and then do a head lift. Slow down, fingers in, up, and head lift, okay? So what you'll see is that with Dari, his fingers pop up, okay? They pop up out of there. So his muscle is actually together now. It used to not be together. And it pops his fingers up, okay? So let's demonstrate what it would look like, Dari, if you actually were separated, okay? So if you go down like this, and I want you to use your hands, Dari, to be the muscles, okay? Do them like the rectus. Okay, so if when you do a head lift, your muscles do like this, and they come up and grab your fingers, don't let it freak you out, okay? That is just a little bit of torn fascia up the center line, okay? Let it relax. So when you go in, you'll feel nice and smooth, and sometimes you can have, in the therapy world, we measure it a 1 finger, 2 finger, 3 finger, or 4 finger. So if you had a really severe diastasis, your muscles would come up and have that much of a separation, okay? So just know that if you have that, it's fine, but there is a protocol to fix it. So I guess we're just going to go ahead and film one long video and just put it all in one. What do you think, hon?
Okay, that sounds good.
Okay, so show them how. The first thing that you're going to do is we want to use the nervous system in the brain to tell those muscles that when they contract, that we want them to contract closer together. Okay, so lay back nice and soft, okay? And then I want you to get your fingers on the border of your rectus abdominis, okay? So you're going to grab the sides of your six-pack muscles, relax, and then you're going to squeeze them together. And this is called approximation, okay? So Dari's approximating, and then he's gonna lift his head and squeeze those muscles, okay? So he's physically holding them together with his hand. Good. And you do how many a day? What do I tell him?
100.
100 head lifts a day. We're joking because he used to have this big separation and now it's fixed, okay? So go ahead and keep it approximated. No, you're too wide. Right there at the rectus, yep. So keep it approximated the entire time and just head lift. So you hold it together and you lift and squeeze. Lift and squeeze and blow, okay? 100 times per day. Now the second thing that you want to do is that when you are FasciaBlasting, you want to make sure that you go ahead and take the 2 claws and go straight up and down the stomach, okay? So when you're using the FasciaBlaster and you're torn, it's fine to use it. It's actually good to loosen that fascia up so that it doesn't tear worse, but you don't want to go side to side across the stomach because what you'll be doing is pulling on the fascia, okay? Now, the other thing that we want to do is make sure that the fascia of the obliques, babe, just show them kind of how to do the obliques, just FasciaBlast the obliques. You want to make sure that the oblique fascia is super loose. Otherwise, when you contract your oblique, it will actually pull on that separation, okay? So when you're blasting the oblique, try to go a little more towards the center with your pressure, like that. And then you can also go up and down on the oblique. He doesn't have any lotion, so I know that doesn't feel good. Okay? So your protocols, for a diastasis recti or a torn fascia up the center of your body is to do 100 head lifts per day with approximation, and then FasciaBlast according to the hernia protocols. And how long did it take? Because my husband actually did fix this problem.
It took about, I saw a big difference after about 30 days, but then it took about 2 months for it really to completely be gone. I noticed that when I first started doing it and it started to close, that there still was a little bit of skin sticking out, like a little nipple or something. But over time that has disappeared. Right here there's like a little piece of skin sticking actually out like this, because I have little
like a little bubble, and it's
little
completely
bubble
gone.
But the skin has over time is laid down, and you can't even tell that it's there.
So good news for people who thought they might need surgical repair, right? Try this first, guys. This will, in 9 out of 10 cases, close everything up.